Hey, good morning. My topic for today is bridging the gap, tackling healthcare disparities in underdeserved neighborhoods. Um, my name is Ryan Miranda. I'm a student at Cal State East Bay. This is my first year. I've been going to the Peralta colleges since I was 18, and I'm at the final home stretch of of getting my bachelor's. So I'm really looking forward to getting that done. Um, so the topic that I chose to write about is healthcare disparities in low-income neighborhoods. I chose this topic because I work as a bus operator at East Oakland, and through my daily routes, you can see how the neighborhoods that we serve in East Oakland, um, how there's not a lot of healthcare facilities. Excuse me. There's not a lot of healthcare facilities, and the ones that we do have are um, community clinics and urgent cares, and they're trying their best. But more often than not, their resources are stretched real thin because they're overloaded by the community, because people use them as a primary care rather than their intended use. So this issue became even more so highlighted when I started doing the 62 bus line out of Fruitvale BART. Some of you may know that bus because that's the bus that goes to Highland Hospital. Highland Hospital is a very popular hospital in Oakland because they take just about anybody, no matter what your affordability is, whether you're insured or underinsured, or any kind of language barrier you may have. A lot of people go to Highland Hospital for just about everything. so that so that got me to thinking that this one place has to take care of all these communities, and I live in San Leandro, and I have four different major hospitals that I live near that I can go to, that I'm blessed to be able to go to and not have to worry about the affordability or being underinsured due to my employment and and where I live. And depending on where somebody else may live, they might not have those same opportunities to get that same kind of care that I get. And it made me really think about it, and not only recognize how blessed I am, but why, like, what is standing in the way from Oakland in particular, um, not having more major facilities to care for their citizens. The reason that we have these disparities in these neighborhoods, I've come up with three different short ideas. Socioeconomic uh, barriers that prevent people from accessing this health care, like high out of pocket costs, um, insurance options where some people may not qualify for for certain medical insurances that are afforded to, like, low income people. But sometimes we hear this a lot in the Bay Area, that I make too much money to be able to get into these certain programs. And also, like, social health literacy. Like, some people don't know that what they're doing is actually harming them. Another condition is environmental barriers. Um, like in Oakland, there's a shortage of healthy food distributors like supermarkets. We find the supermarkets are really spread out, and the healthy food options aren't prioritized compared to the amount of corner stores that we have um, that push packaged foods or snacks, drinks, or liquor. Um, I will say that the more, let's see, I mean, if you were to go into like the Fruitvale district, they have better options, but I think that's because the community that lives there, the Latino community, they focus more on um, their vegetables and fruits as far as selling it, and not so much assimilating to American culture where we don't really prioritize our fruits and veggies like that. They have better options than some of the other surrounding areas, from what I've seen. Um, but like they do a good job of that there, but other neighborhoods like not so much. Um, so when you have areas that don't prioritize healthier food options, or a lot of food deserts in East Oakland, then you face higher rates of obesity and diabetes because you're pushed more towards processed foods. You have more fast food restaurants. Also, not only food, but you face poorer living situations, and yeah. Some of the effects on the people from healthcare disparities are like chronic illnesses like hypertension and asthma. These are common in low-income neighborhoods because not a lot of them are educated properly about the effects or the long-term effects of certain unhealthy activities that they do. And that could lead to, from the individual to families being affected, where now that we've lived an unhealthy lifestyle, now these lifestyles that we're having, like smoking or eating poorly, they turn into chronic illnesses, and they can be poorly treated, or not really poorly treated, but not treated at all, like delaying treatment because you're scared of what they may tell you, or you're scared of the cost of the treatment. And that just kind of adds on to the economic burden of the family as a whole. And also another effect is on society as a whole, because we see that when people live not really healthy lifestyles, we have more expensive health care. Like the reason that we pay a lot more for health care is, like, for instance, if people were to cut back on smoking, health insurance wouldn't be as high. But because people live these lifestyles, they're more likely to use services and have to, pretty much use the services. I mean, like if people were doing better, living better, healthier lifestyles, and being educated on living healthier lifestyles, then there would be less trips to the hospital, because the hospitals would be teaching us about living healthier, more about preventive care That way we know what to do beforehand rather than, oh, it's already here. We got to take care of it now because it's too late. And we're at a point of no return. Some solutions that we could do, we got to talk to our policymakers about like expanding Medicaid and making it more accessible to people, like I said before, that make too much money. That'll make it easier for people to come in and not worry so much about how much things are going to cost, but rather just get it done because you're going to need it to get done anyways. Especially with chronic illnesses, you can't wait till it becomes chronic before you treat it. You got to nip it in the bud when it's still curable, to really make an effect. Also, community-based solutions, like we could, so like adding more facilities in neighborhoods that not only care for the immediate area, but some that are culturally sensitive to the areas that they serve. Like some cultures may not want certain medicines prescribed or used, so we can have certain specialty care that could be helpful in improving overall healthcare outcomes, and also bringing the idea of better overall health in our school systems. I remember going through health ed in school, but that was blended in with sexual education, and it doesn't really teach us about how we should really look at how we should be taking care of our bodies. So introducing health literacy at a younger age as part of our overall curriculum could be beneficial.